Good morning, everyone, and welcome to Holy Spirit Institute of Nursing Education's National E-Conference, Innovation where collaboration, creativity, and technology meet. I, Ms. Sandra Matthew, a third-year basic BSc Nursing student at HSINE, am delighted to host this remarkable gathering. Before we get started, I have a few announcements to make. First, I would like to seek your participation and cooperation in implementing this webinar. Next, if any of you are carrying your phones, please turn them into silent mode to avoid interruptions. If you have any questions for the speakers, kindly use the chat box. Thank you, and we appreciate your kindness in sparing quality learning time for yourself and your professional fine-tuning. God bless your thirst for knowing and sharing. We invoke our Creator, God, to be amidst us as we set ourselves to hear, learn, and retain new things. God, eternal truth, we believe in you. God, our strength and our salvation, we hope in you. God, infinite goodness, we love you with our whole heart. Send us your wisdom and power so that we may remain in gratitude for your wonders in life and at this conference. Dear God, may this hour of learning be savored eternally. Amen. Learning allows us to make sense of the world around us, the world inside of us, and where we fit within the world. Once again, a very good morning, distinguished guests, esteemed speakers, participants, and friends, and a warm welcome on behalf of the members of the management and the entire HSINE family. In the first part of the conference, we have the presidential address by our patron, Sister Lissy Devasi, Executive Director, Holy Spirit Hospital. Holy Spirit Hospital is a multi-speciality tertiary care hospital that offers state-of-the-art and up-to-date facilities at an unbelievably subsidized rates. It is the parent hospital of Holy Spirit Institute of Nursing Education. Sister Lissy is the backbone of our campus, the zone that witnessed 30 beds to 300 beds, lush green, and a caring spirit. I would call her an ideal generator, a designer, an executor, and a visionary leader. The nursing institution's functioning has become secured because of her. Name a want, and execution has already begun with her decisions. Yes, hearing from Sister Lissy is a pleasure. Kindly address this gathering, Sister.
Good morning to everyone in the nursing profession. First and foremost, I like to take this opportunity to personally welcome each one of you to this National E-Conference. It is admirable that the Holy Spirit Institute of Nursing Education is attempting to bring everyone together and discuss common topics and interests surrounding the subjects. Yes, sharing is beneficial, and sharing is made simple by digital technology. The conference topic, innovation, where collaboration, creativity, and technology meet, is particularly crucial and relevant in this context to emphasize something that the nursing profession has long embraced. Every day, nurses collaborate to maintain quality, save lives, and solve complex problems in the workplace and for their patients. As a result, innovative nursing education and practice tactics should be used to bind all kinds of guesses. I'm confident that the conference talks will yield useful and actionable ideas, especially for Gen Z, the technomaniac youngsters. The future of nursing is in your hands, and the scope of your profession is at your fingertips. So make every minute an opportunity, and every opportunity is an experience, and every experience is learning. On that note, I thank the institution and the conference committee for their efforts. I'm confident that we will climb yet another and many more ladders together to success. My best wishes go out to Sister Lalita, Principal of our Nursing Institute, and the entire HSINE team, as well as to you, the delegates. Thank you and have a great day. God bless everyone. Thank you.
Thank you, sister. We value your thoughts. Please keep us encouraged and educated at all times. Thank you very much. In our highly anticipated first session, we will deal with 22nd century nursing and beyond, for which we have Dr. Sister Lalita Rizali, Principal HSINE, to enlighten us on the topic. Sister Lalita's alma mater is St. John's College of Nursing, Bangalore. She has pursued her PhD in nursing education with a major in leadership and management from St. Paul's University, Manila, Philippines. Sister is a disciplined, visionary leader who believes in conviction and commitment. Her charisma is a boon of hope for nursing. Over to you, sister.
Thank you, Sandra. Thank you, Sister Lucy, for warm and loving wishes for us and for the summit today. Good morning, dear delegates. Am I audible to you?
Yes, sister.
Yeah,
yes.
Thank you. Before we move on to the discussion about the topic, I just want to ask you one question. According to you, what is the power of nurses or being a nurse? Anybody can say? Power of nurses or being a nurse means to you?
Sister, excuse me.
Yeah.
Sister, I feel it is a way to reach out to many people, to serve many people.
Yes.
We can see like it is a very divine and noble profession, wherein we can easily reach out and help out many people.
Okay, thank you, thank you. Just as the person has told us, I just want to add up to that. We all know being a nurse means it is highly demanding, yet it is a genuinely fulfilling job as we want to touch the lives of many people. To touch the lives of many people, we want to embrace ourselves with the core values of human being. That is maybe paying attention, as she said, reaching out to people in service. How? By paying attention, by being empathetic and caring. But definitely, if you would say, or I would say, technology is not going to replace these qualities of ours. However, innovation will definitely relieve some kind of burdens that we nurses go through in our daily cases, maybe with the monotonous or repetitive tasks. So how technology will play an important role? We having possessed and possessing some qualities. Now, it is surrounding the technology that the future of nursing starts, where you can say the technology is going to strive to provide a seamless and stress-free experience to the clients, as well as for us, we dedicated nurses. We are going to give an exceptional services to the extreme or to the extent of expectations of the patients. That is possible only through when we embrace kind of technologies or innovations into nursing. So today, we are going to discuss on a century later what is going to happen, or in our imaginative world or in our imaginative exploration, we get into the world where technology is going to be a companion on the service that we would provide. So in the discussion, you will be covering on certain topics That is how we would empower ourselves to empower other nurses. And then specifically to the technology or the innovation, how we are supposed to embrace the culture of innovation or embrace the futuristic landscape of technology and futuristic calling towards technology, and how we are going to clothe ourselves as superheroes because of technology. Coming to the first point, empowering our nurses, for which we need to empower ourselves. So there is a study conducted which says that we need to move from the shift from the traditional decision-making structure within the hierarchical system to something new, that where it promotes shared decision-making. So this shared decision-making is possible through our own empowerment, where we engage ourselves into the task, or where we collaborate with our team. So when we do this, we even allow the bedside nurses, enabling them to give a proper decisions or allow them in decision-making process. And it will enhance the students or the nurses' autonomy. It will promote their uniqueness and ownership, as well as inclusiveness in the care that we would provide to the patients, for which we need to empower ourselves. One means of empowering is where we get into collaboration and creativity, and then allowing innovation to take us. The second point is where we are going to embrace culture of innovation. Now, this culture of innovation is possible through different means as to how we would embrace virtual reality for training. Now, I want you to move, as we know, we are talking about the 22nd century. I want you to move into the imaginary world. Imagine after 60 to 80 years, and surely after 100 years, where are we going to go? So I want you to live or envision a nurse's life of the day, morning till evening, how this technology is going to be our companion, how is that it is going to help us in our delivery of care, promoting quality patient care to the patients. The first one is where we are talking about embracing virtual reality for training, where I want you to, or we want to embrace a new style of learning. So you have got a virtual reality headset, so that will help you to move or transport yourself into the hospital, real hospital ward setting, where you will already start practicing the complicated procedures, like maybe surgical techniques, or you want to put in a catheter to the patient, or you want to communicate to the very vulnerable or agitated patients. So you are getting into the practice already, and then that becomes easy for you. It will enhance your confidence. It will create more competency in you, and then you are able to move towards your care of delivery. So that's the first point, where embracing virtual reality headset that will enable you to get into training before you move into your hospital setting. The second one is empowering patients with wearable devices. Now we have got our smart watches. Now we are going to get into the wristband that will give you, along with that, a sensor that will enable you to get into the patient's data. Now, for example, it will help the nurses. Now, from morning, you have learned already. Now you are moving into your shift duty, where you are going to get to the patients. So you are going to assess the patients before even patient becomes aware. Now, with this sensing technique, patient also realizes what is his vital signs. So you are going to provide real-time data on the patient's heart rate, blood glucose level, or blood pressure. So you have already seen the happening in the client's life, and then you are preparing your plan of care. Now you all write your care plan for your patients, having seen your patient's condition. So this sensor, this wristband, will help you to realize or help to identify the data that is in the patient, and that will help you to plan your care to the patient. Now, what is happening here? Patient himself or herself is aware what is happening with him. So there is a proactive approach that happens with you and the patient. So the delivery of care becomes very, very easy. And the third one is robotic assistance in patient care. Now, we know already during COVID also, we have heard about help that is reached out to many places, and the robotic already into existence, but how it is still going to assist in your patient care. Now, robotic patient care will help you, definitely will it transport your medicines and medical devices from one place to the another place. So where by a robot doing your work, it is in fact helping you to assist you in delivering your direct patient care. So your time for patient care is added more. So you will give a longer quality time for patients where you can give care to the patients. And the fourth one is telehealth for remote patient care. As I said before also, during COVID time, we could reach out to the remote areas or the rural areas in providing care. So we know patients are also aware of their conditions. We can communicate to them, we can direct them, we can check on with what is their adherence to the care or the medication that they are in. So that is with your telehealth for remote patient care. And the last one is IoT enhanced patient care. This IoT is nothing but it's the internet things that will help you with the sensing as a service. So now alarms that is set that will enable you to understand the patient's condition. It will connect you to get through the patient's condition and then provide care. So with this alarm sensing, you are being fine-tuned or you are being allowed to note a kind of a notification comes to you to give patient care. So this is something innovations that you have and that you want to enhance in the future, and that will enhance the quality patient care. Now coming to the enhancing futuristic landscape. The futuristic landscape is now, so far you are in your imaginary world. Now you are already in the century 80 and above, 80 years here, from here to 80 years, and then 100 years after. So now you are already into the world where technology has already come into existence. How the technology is going to be really beside you in giving care to the patients. The first one is enhanced communication. Now, this particular device is used for patients with communication disorders or patients who are not able to comprehend things, patients who are not able to have no proper thought process or thinking process happens. Now, with this device, the nurse, when you get into that century, the nurse try to understand the patient's conditions. So this device gets into the patient's neural pathway, and then you try to understand what is the emotions of the patients, what's the needs of the patients, and then you interpret or you deliver care according to the patient's need, identifying the need based on the neural pathway that has been transmitted through the devices. And the second one is where we are talking about a holistic healing in virtual reality. So much technology has come into existence and we are living with it. Now, how we as nurses get into, now this holistic healing is for nurses and the patients. You need to take a time off. Maybe a kind of a device that will take you to the kind of a forest, where you get into more of mindfulness, more of relaxation, more of understanding the inner thirst or inner need. Maybe it can be an emotional thirst or spiritual hunger, with knowing or deriving energy in yourself by being alone. That energy you are bringing forward to your patient for providing care. So that is your holistic healing in a virtual reality. So you are in your real-time setting, or you are understanding what is there and you are bringing to your real-time setting towards your patient. And the third one is personalized regenerative medicine. Now, this personalized regenerative medicine is where we as nurses, the technology has already gone into the engineering technique, and the design is set where you are going to have a tailor-made treatments, where patient, like for example, you are suffering with some kind of a genetic disorders, where your own stem cell is taken and that is being inserted into you, and then the regenerative changes take place. So where we are going to boost our own immune. So our own self healing is taking place through this particular technology. And the last one is interplanetary health consultations. Now, we nurses, okay, we are on Earth providing care. We are reaching one step ahead with astronauts. Now, people who are on travel, the astronauts, so you also try to monitor what is happening with them. What is their mental status? What is their physical conditions? Is there any emergency happening? So you are able to identify even the astronauts and people who are on travel to identify what is their conditions, and then you will be able to promote care by listing down based on the real-time situation that you have identified by them. So these are some of the futuristic landscape that you would see as nurses in your nursing profession. So these are some of the transformation that is taking place in your healthcare profession and healthcare system. Now we move on to what is a futuristic calling. Now futuristic calling is nothing but with the convergent technology that is available, where we talked in the first slide about our emotions, our qualities, our compassionate care that we give to the patients, how these two things meet together to embrace the future with open arms. See, when we embrace technology as a friend towards care of delivery, we embrace it completely and fully. So definitely this kind of embrace, when we respond to technological entertainment or enhancement. When we are going to embrace this, definitely it will enhance the mode of delivery. So the future of nursing is for sure indeed in the beacon of hope for humanity's well-being. So we are striving for it. We are going to work for it. We are going to embrace it. So our call towards this vocation nursing is not just as me and my patient. We are also going to incorporate somebody else, that's a technology or innovation or creativity or collaboration into providing care to the patients. And the last one is, we are going to label ourselves as superheroes because we are also going to be helped by technology. So our future of nursing is completely embraced by the label or title that we are superheroes because we are aided by technology. How this technology is going to help us? Definitely it is going to betterment our healthcare landscape. Healthcare system is going to, as of now, even in India, we have some hospitals where they are using virtual reality, artificial intelligence, robotic surgery, etc. But it is challenging. Definitely it is challenging because of certain issues that would arise with the system. But we are going to embrace it, hoping that we are only working for the patient's well-being. The second one is it will definitely reduce our task. A very mundane task, works can be reduced. So we can give more time, more creative technologies can come up. We can free up our time totally for patient care. So WHO states in the report in 2020 itself, what will happen in the future. We want to embrace it with more creativity that would reduce our workload, that we may concentrate more on the patients and the technology may assist us. Now, coming to a few points under this future of nursing that will be aided by technologies. First is your robotic cutting back of monotonous talk. Definitely, you have seen in your Googles or you have heard from people talking about robot is going to be our friend. Friend in terms of our little tasks that we do, it will take over. And then we are going to be completely purely for patient care. We got different types of robots that will give you help. There is one particular robot that will help only in transporting things. Maybe you want to take the medical devices, laboratory devices, ECG monitor, ultrasound monitor from your one room to the another room. There is a particular robot that is going to assist you. So what happens when the things have been carried out by the robot, you are with the patient assisting, understanding and communicating with the patient. And there is another type of robot that will take your repetitive tasks. Now, for example, you want to take from your nurse's station to document and then go to the bedside to write your vital signs chart. But it's robot will do. By the time you are assessing taking your vital signs, you can ask the robot to get your documentation to come to the bedside. So that is something that will replace you with your minute task or repetitive task that you tend to do. And there is another type of robot that will help you in high level of prevention of infection. Now, mainly in the operation theaters or ICUs, where this robot is going to be doing the disinfectants. Now, with the long hours of carbonizations or fumigations, our time is gone. So we close the OT and keep it for some time. And we are also dressed up in such a way to do this work. But a robot is going to take up this high level of tasks that will remove the infection from the site or the OT, etc. And there is another level of robot that is going to be communicating to you to how you need to care for patients in a more difficult and dangerous situations. Imagine you are in the psychiatry ward. The patient is very aggressive, not wanting to take the medicines. So when sometimes you run away for your physical safety. So that time there is a robot friendly robot that will talk to the patients, calm down the patient, relax the patients, and then give care to the patients. So this is how robotic is going to take place, some of our work for betterment of the patient health. The next you have remote communication reaching isolated communities. Definitely, even in India, we used this telemedicine, telehealth, telenursing during our COVID time. Now, what we did by this is, or what we will be doing by this is, we will reduce the patients coming to the hospital. Okay, income is another thing. By patient not coming to the hospital, we are going to reduce the cross-infection. That's one nice thing. Second thing, you are also going to allow the patients to take responsibility for himself or herself. And the third thing, you are also going to educate the patients as to how to manage in emergency conditions in the home setting. So that is with a remote communication reaching out to your isolated patients. The third one is where there is also technology that is going to take you to help you to draw blood from the patient. Now, for some of us, taking blood is a nightmare. The reason being two things. One is the patient's vein may not be visible. The second one is you are also upset because you are going to prick 100 times. Another thing, the patient is going to be scared of needles. And the fourth thing is you are so scared, if you instead of pricking the vein properly, you may prick it wrongly and you are going to cause any kind of complications to the patient. Moreover, it is a pain point for patient physically, and it's a pain point for you emotionally. To calm down the situation, mainly for pediatrics, although we saw some kind of a research evidence-based study, or the, what is it called? Kaleidoscope will reduce the pain of the patient while doing IV cannulation, or you give some kind of a play therapy that is going to enhance the patient's interest to take IV cannulation, but still, it is a difficult thing. We can't witness the pain of the child or the patient that they go through. So we have two friendly technology that has come up. One is again, robotic automated technique that will help you to assist. This robotic automated technique will help you to assess the proper vein. One thing is find out which is the proper vein. And the second one is to identify the real vein flow where you can get an easy access. And another type is vein tracer, that is even augmented reality. That is definitely going to help you with the device. It's an infrared devices. You just you are able to assess your vein immediately. So that will help you to get an access to your site also. So definitely the time that you spend in assessing the vein also going to be reduced. The pain that you would induce in your improper positioning of the needle also going to be reduced. Third thing, that you are going to get a proper and infection-free area that patient would get. So this is how, and another technology that will help you, as that is going to be your friendly patient technology for enhancing patient care. The another one you have is explaining complex medical languages with 3D printing. Now, already we have, when we are going to do some, now you can do it in two things. One is when you are going to explain the medical procedure to the patients. The another one is when you are going to feed the patients with maybe cancer patients or senior elderly patients or the pediatric child. Now, medical procedures, before even you want to explain to the patients, like this is a splint that you are going to put to the patient. You explain, patient may not be able to understand. But if you show the splint, or if you show the organ that you want to do it, if you want to show particular, you want to give the catheterization, you show the catheter, you show the organ, and explain to the patient, this is how I'm going to put it. I think the understanding of the patients and the complaints of the patient becomes more better than when we just orally talk to the patients. So the visual imaging is going to help a better adherence to the treatment. And the second one is feeding patients on special diets. Imagine patient after chemo or after radiation, the desire to eat, our hunger buds goes off. So we lose the taste buds and we lose the desire to eat. Elderly patients, they say, they don't want to eat. Child is so adamant not to want to eat. So you show in 3D model a different types of food items according to the specification of the condition, according to the age group of the patients. So this will enhance their liking towards or the desire towards engulf the things that you would provide. So this is a 3D material, or 3D printings, or the languages, medical languages that can be used to enhance patients' adherence to treatment or any particular management related to nursing care as well. And then you have one more portable diagnostics for increased patient care. Now you see, imagine from somebody, you want to take ECG for the patients. You take from your treatment area and then you go to the patient with a trolley. Or you want to do CPR to the patients, you take your big emergency trolley and you defibrillated, take the emergency trolley, big trolley, and you go to the patients. So we are trying to reduce the bigger things, the bigger devices, and then give a pocket articles like what you are having as a nursing students, what you have, a pocket item that will give you an immediate, faster and speedy assessment, and accuracy will be given with this kind of devices. So you have got all portable devices, whether it is an ultrasound, just on the hand-hold ultrasound machines, or you have got an ECG machine. So it's very everything will be given to you immediately. So it is a kind of a pocket sized, user-friendly portable diagnostic devices that will. So what happened? Patient is also not going to be scared of what he's seeing. So it becomes like any mobile that you and me are having it. So that is going to help us in our care of delivery to the patients. The next one is, as we all know, artificial intelligence. Many of you have presented the paper, many of you have read enough articles related to artificial intelligence. Now, this is going to help us in two things. Mainly, to eliminate the unnecessary alarms that you hear. So we call this, when you hear a kind of, when you are in the nurse's station, you hear simply patients ringing. Sometimes by default, it might ring also, or you see cardiac monitor beeping or ventilator beeping or anything that is giving you an unnecessary, or your pulse oximeter, or when you are giving infusion pump, when you are giving unnecessary noise that is being created. Now this artificial intelligence will enhance, remove all these kind of unnecessary things. So it will notify only what is to be seen. Now that default alarms will be screened off, and what is to be seen or heard only will be notified to the healthcare providers. And then there is a sepsis watch. Now there's sepsis watch. It's one of my friends in the UK also had come up with a device where you put this device to the patient side. So patient on maybe diabetic food, or patient on burns, or patients on, highly possibility of developing infection. So such a patients, you put this instruments or the device. So it will notify to the physician or to the nurse, there is a chance the patient is going to develop infection. So before even the infection start developing or start getting into the patient's side, you are being alarmed. So what happens? You are able to prevent the future complications by identifying what is the cause, what is the problem the patient is facing today. So this artificial intelligence, again, a completely patient-friendly, completely healthcare-friendly device that is going to help us in our delivery of care. And we have virtual reality for education. Many of us are doing it. Definitely virtual reality for nurses, mainly for us. Now, before, simulation has become part of us. NABH accredited institutions or NAC accredited institutions, all of us are going for simulation labs. The reason being, now at the demonstration site, but before even I move on to the hands-on experience, I am going to touch, feel, and do, and get confidence before I'm getting myself practice ready for my real world clinical setting. So I'm seeing everything visually as a live organ. and I'm touching it, I'm doing my bed bath, I'm doing my catheter care, I'm doing my tracheostomy, everything I'm doing it. So I'm getting myself ready. So practice ready individual I become. Definitely my confidence is boosted. My skills are developed. And then I'm going into my real world clinical setting where I'm going to give care to the patients, not to cause any error, not to cause any harm, and not to cause any injury to the patients. Definitely virtual reality is going to be one of the most sorted out friend of healthcare profession. The last one is we have new tech for better medication management. Now, what is this new tech for better medication? You might have heard this chatbot or companion robot or digital bills. Now, these things are more of an accompaniment with us. Now, I'm an isolated patient, or I'm an elderly patient, at home nobody is there. So I don't know what time I'm supposed to take medicines. So now these chatbots, it will help you to remind you, just going to remind you, Lalita, you have to take this medicine. So it is a reminder, even if I forget. So then I am reminded to take my medicine. This companion robot is going to be not just going to remind me that I need to take medicine, or it is also going to remind my healthcare professional who has prescribed me for that medication to be taken. So it is going to communicate to me, yes, Lalita has taken this medicine at this time. That is one way of companion robots. The other companion robot is when I'm alone at home. Nobody is there to talk to me. So I have a robot in front of me who will maybe, revert back what time or respond to me. Now we have got an app, Alexa, that will say, Alexa, you put off the light. Yes. How are you, Alexa? Yes, I am fine, Lalita. There's a response happen. It is something like that. That is an application. So a robot that is going to be completely with you as a friend in need in your any time. So it is going to talk to you. It is going to remind you. It is going to remind the doctor who has prescribed. It is going to even send the message to the pharmacist who has delivered the medicine to you. And the last one is your digital pills. Now, digital pills is keeping a track on whether I'm adhering to my medicines or not. I might skip my dose according to my need. I'm so sleepy, so I don't want to take. So, okay, I have to take, but it's okay. Even if I don't take now, it's okay. Some of us buy antibiotics. One day we take, and then we look for cure very next day, which is impossible. So you want to take it for 3 consecutive days or 5 consecutive days. So it is a reminder or a call whether I am adhering to this particular medicine or not. So these are kind of 8 technologies that is going to in future or after 100 years and the 22nd century to say that we are superheroes because we are assisted by technology. So these are the few things that I want to give to you. Now, having said that, I just want you to watch this small video that will be a takeaway for you when you go home.
Healthcare will undergo dramatic transformations. Medicine will become more precise. Value will shape care delivery. Patients will become empowered consumers. And digitalization will transform every facet of healthcare. Patients will have a digital twin, a customized computational model of themselves, enabling Dr. Clive to anticipate illness, guide therapy options, and predict outcomes of procedures. Expanding precision medicine will enable radiologists to make highly specific diagnoses for Stephen without unwarranted variations. AI-powered decision models, fed by vast population health data, will improve diagnostic accuracy. Healthcare will become anticipatory, organized around Paula's medical conditions, and available around the clock, transforming care delivery. Multidisciplinary, highly productive care teams structured around patients and their needs will collaboratively deliver the full cycle of care. All interactions with John will become convenient, personalized, and compassionate, improving patient experience. Supported by real-time monitoring and guidance, John will become more empowered and have physical and virtual access to care when and where he needs it.
So this is a takeaway. The video that you saw, I think if you have really heard it, if it was really audible, you understand the multidisciplinary approach, collaboration, creativity, and technology, how that is going to enhance our diagnostic procedures or kind of finding out what is the real cause, and then how we are going to do the management to the patient. It's going to make us very, very easy and comfortable and cozy for us healthcare professionals. So is there any questions among the delegates?
Excuse me, sister.
Yes.
Sister, how can technology can be used to overcome workplace challenges?
Just one. Technology, pardon me, sorry.
How can technology can be used to overcome workplace challenges?
Okay. Now, what do you understand by communication? Now, communication is something that you really directly talk to someone. So technology reduce the workload or reduce the challenges that you face in your technology is made it more easy by communicating. Now, for example, you found the monitor is not functioning. So prior, if you have identified that, notified to the concerned person, if the care is taken and the repair is rectified, definitely you are going to give care to the patients. So your supervision, your time plan, your management also matters. So have the priority for everything. Now, for example, your thermometer is not working and you are not able to check the vital signs in the patient and you are going to write as you want. That is not what we are supposed to do. That can be solved if you have already morning when you're doing the inventory check itself, you could identify there was no thermometer or thermometer was not functioning. So it is your constant counter check and the communication will enable you to overcome your technology problems. Definitely systems are going to cause errors that can be prevented your counter check.
Thank you, sister.
Fine.
Excuse me,
hello,
sister.
Yes.
Sister, as you introduced the topics of robotics into healthcare settings, so because of that, there might be chances of unemployment for nurses and other healthcare professionals. So what are your views on it?
Don't be scared already. Don't be scared. Right now also we have got all these robotic surgeries. See, they are going to only assist you. They are not going to take the complete job. Okay, they are going to assist you. Definitely, you are going to be an assistant to it, or your robot going to be your assistant. Definitely, this is what we are talking about, collaboration, how we are going to innovation, where it is a mixture of collaboration, mixture of creativity, mixture of technology that is going to enhance the patient condition. So definitely, we together will work for the improvement of the patient. So we are not going to be unemployed at all, provided you find your own scope, your own the extended and expanded role. If you find even with robotic, it is going to enhance your profession as well. So you don't need to be run away from or fearful of what the technology is going to address to you. It's only an assistance for you.
Excuse me, sister.
Yes.
Sister, then what will be a relationship between a patient? Will it affect because of technology?
No. If you remember when I was talking about the different types of robots or different artificial intelligence, we said there's one robot that is going to carry the things to the patient side. I didn't say this is going to talk to the patient side. Definitely in telemedicine, we said remote condition, there is a robot that is going to communicate to the patient who is going to be alone, where you cannot reach. But at the bedside, we said this robot is going to carry or assist you in minute works where your interaction with the patient will not be hindered. You are going to spend more time in talking to the patient. You are going to, for example, you are going to give back massage. Definitely, robot is going to help you to carry out those resources. But it's you who are going to talk to the patient. You are going to give complete stroke. You are going to give complete appointment, etc., etc. So nothing that will not definitely take over your job or your communication or your interaction, your personal touch. We said in the beginning, nurses are definitely, our job is very demanding. And it's very fulfilling because we have got a direct touch with the patient. The direct touch will not be taken away from you with the robot.
Thank you, sister.
I think, Sandra, we are done, I suppose.
Thank you so much, sister, for the wonderful knowledge that you have shared with all of us.
Thank
Thank you so much. Moving on to our second speaker for the day, Mrs. Pooja Nair is an associate professor at PD Hinduja Hospital and College of Nursing, a PhD scholar and HOD of the Medical Surgical Department. A very energetic young lady has a jackpot of credentials. To name a few, she is a loving mother, smart nurse, friendly teacher, challenging colleague, and authentic leader. She is soon to be a mud-sorted nursing celebrity. She is the epitome of learning, representing the institution and university at the conferences and bringing laurels in her smartness. We feel blessed to have her as a speaker on the topic, Nursing for Gen Z. Over to you, madam.
Thank you so much for the kind introduction. And I am extremely delighted and happy to be here. At the offset, I really thank Holy Spirit Institution of Nursing Education, Principal Madam Sister Lalita and Sister Lissy for giving me this opportunity to share my views and thought on this wonderful forum. As I was observing the session since morning, I am extremely happy to see the way that things are organized and the very beautiful topic that has been selected, which will really help nurses not only to give safe patient care, but it will empower them with confidence and instill proactive approach, what Sister Lalita was rightly saying. Thank you so much. And I bring greetings from PD Hinduja College of Nursing. But I take this opportunity to say that Holy Spirit is my second home, because I have come multiple times to Holy Spirit and I get a very, very warm welcome every time when I come there. So I'm extremely very happy to be a part of this program. I'm sure I'm very happy to see the number of participants that are there. So with technology, I really want these participants to just if you can put on your video for some time and let's have a virtual wave before we begin the next session, if you can, with your limitations. So a wave and hi to you. And I'm sure this is one of the technology that Zoom we are using, but I'm sure you will benefit from all the session that has been planned. So I'm going to talk about nursing for Generation Z. I strongly believe that all of you, those who are attending, do fall into that Generation Z category. So I'm sure you are definitely born between 1990 to 2010. So all these Generation Z nurses are attending and you are going to be the future of nursing. So what I am going to do in my couple of moments with you, that I spend with you, I'm going to tell you that who and what drives you and what roars you. Because some things that really drives you and some things that you really find it difficult to get through. So what roars you? What strategies can we do in order to facilitate learning and accountability in nursing Generation Z? So I'm going to talk about it, give you a little bit of teaching learning strategy, the tips, so that you can navigate successfully towards your nursing career. And you are going to be, as I said, the future of generation. So we need to embrace the future and we need to accept that you are going to lead the way. So we need to welcome you whenever you come at the patient's bedside or any organization. So as you see that Generation Z represents the newest wave of application. I'm sure this picture on over here, can anyone just put it in a chat box or you can tell me, do you know who these people are? The one that I've put it over here. You've heard of Killy Paul? Any one of you? Okay. So I do not know whether you are muted or I cannot see any response from your side, but I believe that you must have seen these people. Yes. So I believe that you must have seen these people in the past. They are from Tanzania and the love for their country and passion for learning and music has made them one of the popular stars of Tanzania. And to very surprise, they are very known for lip syncing, especially those Bollywood songs. And though in Tanzania, where electricity is difficult, where technology is far difficult, they manage to use smartphone and learn different ways of lip syncing through YouTube, and they share their post and video on Insta, and everyone knows them, the country Tanzania, through them. So the generation Z is going to be, we are aware that they are the first generation of digital natives. They are tech savvy, they are visual learner, and they enjoy collaborative learning. They are passion driven, and very vividly they are hyper connected to the screen. So it's very important that we need to identify their unique learning traits in order to meet the healthcare progressive learning demands. In the morning when I was looking at it, I got a very nice article. I'm sure when you can go back and read when I share my presentation with the organizer, they were saying that the first 8 seconds is the capturing the attention of Gen Z. So I'm going to talk to you for a couple of 30 minutes, but I strongly believe the attention span strongly when you're truly engaged is just 8 seconds. So the recent studies have shed light on Gen Z shorter attention span, revealing that every industry plays a very important role in order to introduce a very innovative teaching learning strategy, even at the bedside when nurse educator trains the novice nurses, and even when you're interacting with your patients. So the research conducted by Microsoft in 2015 found that average attention span of Gen Z was only 8 seconds, which is something which is very alarming and we need to keep in mind. So what motivates you all? Motivates the Generation Z. And this beautiful article talked about what roars you. That means what are the barriers and what are the intrinsic motivators which you are looking at. So this Generation Z of nurses, when you direct learning, when you tell them these are the things you are expected to learn, or you give a formal training to them, they get bored and they're not interested into it. So what's very important here is no more the sage on stage will work. It is just a guide by my side, learning through facilitation. That means you share them, these are the goals or objectives you are expected to achieve, and these are the opportunities or avenues available. So you make them responsible for their own learning. So learning through facilitation is what motivates them. A very enthusiastic and passionate. So it's a blend of multiple well-planned activities or interventions you plan in order to meet the needs of these learners. So they need a very enthusiastic and passionate presentation. Content value revealed before presentation. So they believe that, if you give them some kind of pre-reading materials, they will better review and come, and it should be more content. The content what you give, it should be very short and brief. If you give a long content delivery, it does not attract them, and they believe in experiential learning. So here comes the topic that how we can add innovations or how we can use experiential immersive learning techniques in order to take care of the needs of the current generation. So it's important to have facilitative learning. And the analogy of sand, I'm sure you will believe and agree that if we try to hold these Gen Z tightly into your hands, the stronger you grip it, the faster they will escape from your hands. So it's important that we give these nurses time to express their thoughts and think out of the box. I was very amazed to see the kind of questions that you were asking. That means you were really thinking, even at you were thinking about your future. That is, robotic nursing going to replace me? So you have a strong critical thinking and clinical judgment skill, as if what should be my boundary and how can I achieve, what should be my role? And so I was very happy to hear that question. So that sets you apart that Gen Z learners are self-directed learner. They are globally aware. So you have the overview of the market because you are too much aware, engaged into online learning. You're a good communicator and problem solver. So we need to keep all these strategies into mind while we are introducing the teaching learning. I'm sure you have watched this just to add movie, Bollywood into your humor into the presentation. I'm sure you have familiar with all these three faces. One is Amir Khan, it's a movie, Three Idiots. So in Generation Z, you will have intelligent people who are full of doubts. So it's important that we need to acknowledge them, answer their query on time, and use their potential and skill to harness their own learning. And while you have those stupid ones or the rote ones who are just doing strategic kind of learning and who, are just worried about their grades and they're not involved in the patient care. And the other ones who strongly believe that if I do something to my patients, I should get some reward, or if I do this thing properly, I should get. So they require instant gratification. But what works better is the carrot and stick. Both methods work when we talk about engaging Generation Z. So let me introduce to you some of the strategies which you can adopt and your nurse educators or your teachers or your facilitators can adopt in order to take care of you during your learning period. So the first and foremost is it's important that we need to have an open learning environment. If you create fear is a negative emotion. Do you agree with me? Fear is a negative emotion. And what are we looking at? Success, or we are looking at good optimal patient outcome, which is something positive. So if you create a fearful environment, the learning is not going to happen. So it's important that you need to cultivate courage and resilience and introduce such methods which they will enjoy, they will learn, and which they will never ever forget. Because nursing is something you cannot afford to forget a single thing and afford to do even an error which can cause 0.0% error actually is not accepted because it can cost life of the patient. So what's important over here is to create an open learning environment. So there is this particular model which is being given by Charles Jennings. He says that you can unlock potential and embrace growth by practicing these 70-20-10 model. And the 70% is nothing but practicing skill. So what they are trying to say is that in the Generation Z, 70% of the learning should take by learning by doing. So even when you're novice nurse, when you, where I do talk to my colleagues who are nurse educators and nurse leaders at various forums, I tell them even during your induction program, do not just take formal training for them. Take some immersive learning or experiential learning session, incorporate simulation-based learning, incorporate clinical encounters, case scenarios, which will help them to think critically, prepare their own individualized plan for the patient and navigate them throughout the day. So practicing skill, that is 70% of the time is being appreciated and 20% is peer learning. When you sit with your colleagues, when you discuss, when you use peer learning forums, I will be discussing few of them with you. It's important that it stimulates learning because you have one idea, you sit with another person who gives you one more idea. So 1 + 1 definitely becomes 2. So informal training with colleagues and also experts who are very specialized, you involve them during their learning process, it definitely helps. And only 10% is what we are doing today, is didactic learning or teaching methods that we are going to use. So 70-20-10 model is being used. So how can you use these 70? There is a very freely available tool called as Nearpod. I'm sure you also during your, when you take some sessions or seminars, or while teachers also, when you take some sessions, you can have these Nearpod tools where you can elevate learning with Nearpod activity. Students can prepare their own lesson, the teachers can prepare their own lesson. She can put a quiz, she can put some kind of pre-reading material, and these the quiz will be learner paced, but it will be monitored by the teacher, and there will be feedback which will be given, because most of the Generation Z learners, they want feedback. If they do well, they want a feedback. Did I do well or not? Or did I falter somewhere, or what went wrong? So it's important through these Nearpod software. We really use that in our organization, wherein, you have taught them something, you give them some kind of small quizzes or learning small vignettes. They will review it and they will solve it. They will choose their own players, and then you can see the result also that is being displayed. Another thing which I strongly believe in nursing, we prepare students that these are the steps that you must follow while giving tracheostomy care, or while giving catheter care, or while giving any kind of interventions or therapeutic interventions. But we fail to prepare our nurses to think, what if when something goes wrong, and what will be your responsibility? So this is very vividly we are using in our organization, and I did present at one of the international conference. What if scenario? You can create a blog of these what if scenario. Let me give you an example over here. So you can prepare small what if scenario. For example, what if you identify that your patient with type 2 hypercapnic failure was not tolerating NIV and suddenly became drowsy and was not responsive. So what will be your reaction and what actions will you take? So you put your patient who was on respiratory distress on NIV, you did not monitor, and after 4 hours you are coming and you see that the patient is drowsy. Will you again put the patient on NIV, or will you initiate some intervention? So such kind of what if scenario and action. So what should be your action? I've just put some actions over here. So you can put these what if on a blog, and where students will put their responses or put their actions. What is my role and how will I respond? And then the facilitator will give her feedback and comment, and this is how that learning will take place. So even now, this small what if peer blog will help you to even use your critical thinking and judgment skill. Another thing that we can use for this nursing Generation Z is something called as escape room. You read an article on escape room, it's amazing. There can be a physical escape room or a virtual. So imagine right now you're in a Zoom, we can consider that is that you're in a trap somewhere, and you give them certain clues, and through this clue, you help them to identify a differential diagnosis, a case, solve that particular problem, prepare a management plan for that case. How will you navigate or help? For example, if you have a case, a patient who comes with a MI, these are the classical features. What is the type of MI, whether it is STEMI, non-STEMI, whether it is stable angina, unstable angina, how will you identify what type of MI it is? What is the first immediate management will you do? And you give those clues. And through this clue, you give a time limit. Suppose it is 30 minutes. Within that 30 minutes, they have to solve this particular problem. They have to find the key of this lock of the room. Okay. They have to open the lock and come out. Until unless they don't do, they are not able to come out of the lock. And you give them very specific time and very proper, well-organized, well-stated clues, which will. So it's a fun way of learning, where you can escape from the physical or virtual room. You can solve hidden clues. And the best thing is that you've heard about these hormones. It helps you to release endorphins, which is a natural painkiller. So it eases your stress. It helps you, reduces your anxiety. And what sister was saying, it prepares you well at the in your simulation lab, so that you are able to prepare yourself or handle any emergency at the bedside. So nursing Generation Z students, they are very smart learners. But what we observe is that they are not able to manage their stress. So this is one way where you can even manage your stress, and it will create an ideal environment for you to focus learning. And it uses Bloom's taxonomy, and you can use at every level. You can reach from the level 1, that is remember, to you can go up to create. You give them solve puzzles by applying their past knowledge, especially in the new situation. So this is another way where you can, a picture is worth 1,000 words. So a complex idea can be conveyed with just a single image, namely making it possible to absorb large amount of data quickly. So these are the things that which I'm very sorry for the interruption. So it can help you to think out of the box, refrain from being excusitis, and very, very important, it can create a reading culture. So this is a very another way where you can, use the context, action, and result, a car approach to achieve the desired goal. For example, you can give a situation, a critical situation, and the Gen Z nurses have to think what steps they will take in order to resolve this particular problem or the situation, and what will be the outcome if they are not able to perform what is expected, what can be the consequences of or the action. Because most of the times we are aware of what is to be done, but we are not aware that what can be the consequences or the action. So it's important to cultivate a healthy teaching learning environment also when it comes to handling Generation Z nurses. Another thing is you can use these technology while you do a review of a case study. So I'm sure you all take some or other opportunities to present your case or share your experiences. One of the tools that is available is called as the SNAPS. That is, you summarize the case, you narrow the differential diagnosis, you analyze what can be the possible differential diagnosis, and you probe preceptors. That means you probe questions in order to plan the management plan, and you select even the case-related issues or challenges. In this, the facilitator plays a very, very important role because it's important to provide constructive feedback when you handle this particular kind of SNAP method, which requires immediate feedback, so that the nurse will know that, okay, this was the problem and this was the possible differential diagnosis and what should be my role here. And what's important that while we train nursing Generation Z, is important that we need to train them to take care of patients, especially need to use strong clinical judgment and critical thinking skills in order to analyze the case from multiple angles and thereby promote a very comprehensive understanding of the situation. When in what I strongly believe is one of the another Gibbs reflective cycle, which is very vividly used, because if you look at the studies and when these Gen Z are coming at your workforce or is going to work in the healthcare system, feedback is something which is very, very important. Now, before feedback, what's important is reflection. So you can use these reflective model wherein the Gen Z, once she encountered a problematic situation or a patient, or she encounters a near miss event, she will reflect on what was your thinking and feeling, what else you could have done to make the situation better. Okay, if it arose, why did it arose? Okay, what else could have been done better? So if you use this reflective cycle, the nurse does she understands and she introspects and does self-awareness, and then she is being given the feedback, which is very constructive sandwich method feedback from the facilitator, which will help these Generation Z nurses to navigate. So a new generation of nurses is here. I'm sure you are all the Generation Z. And in this article, what was the key takeaway which I would wanted to share is they have given certain tips for supporting the Generation Z. And one of the tips which I reiterated is feedback. And feedback can be given through near-pod activity, through Flipgrid. There is another something called as escape room, or you can use your simple Gibbs cycle to reflect and give feedback, because it is important to create a nurturing and reassuring environment where feedback is offered frequently. But very importantly, keep feedback short, prompt, and succinct, and mix positive feedback with areas of improvement. That's very, very important. So these Gen Z nurses require feedback. So anything that you plan or anything that you so as your patient, when you do something When you monitor a vital parameter of your patient, the patient looks at you with an eyes to know what is the feedback. And as nurses, you need to be empowered in order to give even feedback to your patients. So risk, that means they, they are very, they find it difficult to have interpersonal communication and team building. So that is what Gen Z, they can work individually very well. But when it comes to working collaboratively as a team, they find it very difficult. So through this team building games and activities, we can inculcate a culture of Esprit de Corps or team within the nurses. And technology, they enjoy being using multiple technologies. They are champions of using technology. So we can use this technology. While one of the questions the student asked, you can use these high-tech approach, but at the same time, at all times, we will retain the human touch or humanism while we are handling with the patients. So the affective domain also can be taken care while we are using these technology, because it's important to create, the empathy, the desire to help not only your peers, but desire to help your patients is also very important. And effective communication. What they said, that there are some skills which these Gen Z nurses need to have, and through all these methods that that I have introduced, it can help you to enhance your critical thinking, clinical judgment skill, anticipation. Always think that what can happen if I do this, what could be the consequences, and develop a good observation skill. Even if your patient says, okay, I am having a new onset pain, there was no pain. Why this pain suddenly appeared? Why is my patient complaining of headache suddenly? So all these questions you need to ask when you are at your bedside. So to conclude, I would say that Gen Z nurses, you are those nurses who can navigate adversity. You may come across multiple challenges. You may come across scarcity of resources, but you need to use all your tools and technologies in order to solve that problem and make every patient's journey unique. Be the nurse as you would want when you want your family members to become a patient.
Thank you, madam, for the informative and interactive session that instilled in us the possibilities that lie ahead in the ever-evolving field of nursing. Now that the forum is up for discussion, you can post your questions or ask in the chat box.
I'm so sorry for the interruption. If you have any questions, you can put it on the chat box.
There's a question from Khushi Singh. How can we encourage future generations to choose nursing as a profession?
Wow, that's a beautiful question. And that is the a very gray area, because we are really looking at empowering and encouraging nurses. So if you ask this question, it's very important to sensitize the youth to get committed to this particular noble profession. When you look at nursing, I always believe that, whenever we go for any admission enhancement campaign, or when we talk about nursing, by doing nursing, it will not only give you a green card to USA, but it will give you a green card to heaven. If you are looking for service in humanity, and if you want the world to transform into such a beautiful and better place, you need to take a step forward. You need to, embark on this journey, and we ourselves can, encourage that I am very happy to be a nurse. It was, let me share my personal story. I was not very fascinated for becoming a nurse. My father, I being from definitely from a Mallu family, and I was being pushed into nursing by my father. But after I entered into nursing the day one, from that time till now, I always thank my parents because it is such a wonderful profession. And especially now we have come into academics. But every time that I go in the clinical area and when you interact with the patients, the invisible blessing that you get from your patients is something which will transform you, and it is a kind of investment into your patient's life, and you need to be ready to invest in your patients. You need to be ready to invest in yourself. And by being a nurse, you are an all-rounder. I'm sure all these, I think Apurva, I am very happy to see her as a student here, and being transformed into such a wonderful person now. So in nursing, it teaches you to be techno-savvy. It teaches you to be a good mentor, a guide, a nutritionist, a physiotherapist. You are an all-rounder. So if you are looking at for your career opportunity, your career growth, at the same time, if you are looking at developing the nation per se, you can definitely choose this profession as nursing, and you will enjoy. You need to enjoy and love what you do. That is what I would conclude by saying, that whatever you want to do, just give your 200%, love your job, love your patients, and automatically you will get those invisible blessings. I got some question. Excuse me, ma'am. As we discussed, escape rooms would train us nurses for scenario which are under favorable condition, but in real situation may be different, like patient may not cooperate. Yes, you don't have to do it in real situation. You have to do it. It can be physical escape room is nothing but you in your simulation lab, you can choose one lab. You can put some clues. You put 4 to 5 a group of student learners there. You can observe them through the console room. You give those specific activities which will help them to unlock one clue, open the lock and go outside, so that they are able to, when they solve that problem together as a team, there's a lot of accomplishment, right? And at the same time, a lot of learning takes place. So what I meant was physical is in the simulation lab. Virtual is you can create a virtual escape room. You can share the link to the students through their smartphones. They will open that, they will put the code, and they will solve each and every clue, and they will escape through that. And if they are not able to solve, through virtual room, we can create alarming music. Like, for example, what we do when we can create, something which they did wrong. There will be a big silencer, which everyone knows. Yeah, this someone got stuck here and they need help. Are you understanding? So you can use various methods, but definitely not at patient's bedside, which they will not cooperate. But all these learning tools will prepare you so that you can take care of your patient at the bedside. So I think, thank you so much. And I really thank once again the organizers for giving the opportunity. And it was a wonderful exercise, which I myself got opportunity to learn. So I really thank you, and hoping to connect in the future. Have a wonderful session.
Thank you so much, ma'am. Moving on to our third speaker for the day, Ms. Apurva Yanji, lecturer HSINE, is a passionate advocate for educating the young minds. We'll deal with the topic, Tools for Future Nursing. Ma'am is a found pearl of PD Hinduja. Ma'am has a second position in nationwide quality of care network in collaboration with UNICEF. She is a technology-driven educator who wears innovation as her attire. One such innovation is designing brain-friendly jackets for mastectomy patients. Designing and learning about apps are her jewels. She is fondly referred to as the technical expert. Over to you, ma'am.
So very good morning to one and all present here, respected Sister Lissy, Dr. Sister Lalita Rosali, and of course Pooja ma'am. A wonderful session, and this will be the last session for the day. So let us begin. Allow me to share my screen. Am I audible? Am I audible to you all?
Yes, ma'am.
Thank you so much. We'll start with the presentation. So since the beginning of human existence, tools have been an integral part of development, no matter whether it was a Stone Age period. As human progressed, understand the importance of survival, human have included many things. Of course, nursing is also closely associated with different type of applications and tool for optimizing patient care and providing high quality patient care. As there was new era beginning, the teaching the techniques of how clinical opportunities was available for staff nurses. Over the period of time, we have seen enormous growth in that. So today's session will be focusing upon, as tools are a crucial part of human evolution, tools for future nursing. We'll start with the session. So learning objective for today's session is to understand various technological advancements. As since the beginning of this conference, we have seen different types of things which are available right now. We'll try to cover up all those things. Of course, there is vivid and enormous things and opportunities which are available, but at least few concepts, if it is clear at this level, then we will try to approach very nicely and pave the road for future nursing. So area today we are going to focus on is your artificial intelligence, ChatGPT, reality, which is augmented and virtual, robotic nursing, and few high-tech gadgets which are available right now in the market. So let us begin with very highly anticipated artificial intelligence, which is right now there everywhere. So can anybody tell me what is exactly artificial intelligence is? Anyone? Okay, so we'll see what is artificial intelligence is. So artificial intelligence, AI, is a relatively new discipline beginning in somewhere 1950s. We'll see the timeline as we move ahead, but gaining much more attention in this last decade because learning is improving. Students want to be very quick. Even if a small child, we give a cell phone to a small child, the child is aware how to unlock. But back then when we were kids, or the generation of your parents were kids, existence of mobile phone were not there, technology surrounding environment was not there, but in last decade it has developed a lot. So AI is an intelligence exhibited by machines. So if we break the word artificial intelligence, the intelligence is artificial. It is generated over the period of time. It is not something which is there, but with protocols, with your local networks or your wide network area, creating few protocols or programs or connections. Through that we can improve it. In computer science, an ideal intelligent machine is flexible, rational agent that perceives its environment and take action. So here you can see one of the robot which was made up in 1990s in Massachusetts, MIT, Institute of Technology. So this is Kismet. So why I have shown this particular type of robot, because this robot was having an optic sensitivity, that the visual sensitivity was present, and even the listening sensitivity. So they had programmed this back then in 1990s. Next, a very important person in the field of AI is John McCarthy. He is one of the person who has coined the term artificial intelligence. He was an American computer science scientist and cognitive scientist. So there was this conference which was held in Dartmouth, as we are going also to the conference. During this conference, the significance is more because all these scientists have a computer engineer, technological people who have actually discussed about artificial intelligence the way we are also discussing it. That back then they have discussed all these terms in this conference. Now, if we see the timeline of artificial intelligence, beginning from 1950, Turing test was conducted. Turing, he was one of the computer science, Alan Turing. He started using machines for intelligence, for doing small work. In 1955, of course, AI was born by John McCarthy, actually coined the term. 1961, as we move on, Unimet was inculcate. It was a first industrial robot. Then there was Eliza. Eliza is significant. It was one of the chatbot, what we see right now, ChatGPT. They have inculcated Alexa back then. Then there was Shaky in 1966. Then if you see the timeline between 1966 and 1977, there was a big gap. So AI, it is known as AI winter, many false starts, and many people concluded AI as a dead end because, of course, there was recession. If you see in European countries, recessions was there. People were not encouraged enough to inculcate technology. But back then, in again 1997, so there was this Deep Blue. Then there was, as you can see, there was Kismet in around 1998. Then I don't know how many of you actually remember Sony had launched its first robo pet. So this pet was specifically designed to elevate people who are alone or people who have anxiety. So dogs are considered as one of the most faithful, and pet therapy is also considered one of the best therapy for human being. So they tried to inculcate few points in this robo. So you can see in the timeline, the balls are there. You can tell him to flip around. Then in 2002, there was Romba. And 2011 Siri. Of course, if I say tell Siri, or as ahead we'll go with Alexa, Siri was developed in 2011, and then Alexa came. If I just ask Siri to tell me what is the weather, Siri will just get activated right there and now and tell me what is the weather, how things are important. Any question, which is, of course, over the period of time, they have incorporated voice recognition, all this system in the softwares. Then again in 11 was Watson, Eugene, then Alexa, of course. Then there was T, it was a Microsoft based chat box. There was Alpigo, which was one of the Google AI. If you search, if you go and search right now on Google, there will be a small filter icon in your Google search. It is nothing but integration of AI in your Google search. Anything you want to search will be there itself. They will try to integrate AI in that. Then we'll move ahead. So types of AI, very, very important. First is on the base of capabilities. We are trying to make protocol on the base of functionalities. So based of capabilities, there is narrow AI. So narrow AI, basically what you all have in your phone right now. The way you put your thumb, that is the only function. If I put another things on that, maybe it won't be recognizing. Few phones have eyes recognition, which is very, very different thing. Few phones will only have thumb recognition. Super AI, I'm trying to inculcate multiple aspects. Now this AI is also trained to understand human emotions and different concepts. And general AI, which usually we use, will see all these things. Then there is functionality based is your relative machines, self-awareness, limited theory of mind. Then next is AI based on capabilities, we'll see. So artificial narrow intelligence, also known as weak AI. Why? Because it has a very definitive task. Doesn't mean that it will not do the task, only the section is very limited. If I do the thumb printing, I do the eye scanning, I can only able to do that. Artificial general intelligence, also somewhere known as a strong intelligence, because we are giving a broad spectrum of protocols to this section. Artificial super intelligence, this type of intelligence is where humans are finding it difficult to cope up with, because ultimately AI is generated or made up by human itself, but they have made it so nicely that now AI is taking up their jobs. You must have seen in news and you must have seen everywhere AI has taken certain jobs. people are laid off from their jobs. So this is what artificial super intelligence they talk about. Then in general, I will like to discuss how AI works. So there will be an input, and if you see the light purple section, there is a learning pattern, there is a prediction pattern, and of course the tasks which we perform. Ultimately, whatever technology we are using to improve our small day-to-day tasks, so we don't have to keep up with, we have difficulty in keeping up. The smallest example I would like to give you is, back then we had phone diaries. Diaries was there. There were many things we used to write and keep. Do we do that right now? We don't do that. All we have is our cell phones. We don't even, most of the homes don't even have landline. Cell phones is what which are helping. So the task, slightly the improvement of task has improved, but of course, if we talk about memory, the memory skill which back then people had to remember all these numbers, we don't have that much right now, because the amount of number have also increased and the storage also. So this section is divided into machine learning, neutral learning, and expert learning. In machine learning, there is a deep learning, predictive analytics. So even you must have gone through your phones also. When you send a message, I want to buy a certain type of product, or certain, for example, I want to buy a soap. If you go on any of your social media, you will start seeing the ads of that same thing. So why it is happening? Because now your system has identified the words, the system has identified different concept, and cognitive computing has taken place. Computer vision, speech recognition, language processing to convert one language to other, to understand what different types of language. So I will make a software which will have this particular language, and this particular language can be converted. And ultimately, with all this section, I will have and data processing, data generation, and data distribution. I do not only have to convert, but I also have to distribute my data. So AI is helping me with that. Then next is so why there is a need of AI for us basically. So there are there is vast section to talk about this topic, but I have just make it short till 4, that global digitalization and more computation power. You can't deny that technology is coming up. You can't deny the factor that progress of human being is technology based. No matter what you do, you have to inculcate technology. You can't be the person who is not interested in technology right now. You have to show some interest, as globally also we are developing excessive data. At a day, I have 10 patients coming in my ward. It is not possible for me to enter everything in 1 hour for each patient. So we have barcode scanner. So it is a generalized scanning system. I don't have to do anything. I will scan the barcode, and ultimately whatever data I will receive, that I will just save it in my section. Today this person came, I have all data. Better statistical algorithm. If, for example, in your board, there are 10 patients and 5 of the patients have TB, 5 of the patients have dengue, or other patients are there which have different type of disease condition. So I don't have to sit, okay, this patient has this issue, that patient has that issue. Automatically, my server will tell me that at the end of the day, that Ms. Apurva, your patient list was this, and among your 5 dengue patient, 2 dengue patient has discharged. Ultimately, end of the week, I will have data, end of the month, I have data, and end of the year, I have data, and it is an investment. So investment in point of future, a better investment. If we are investing at software levels, if we invest right now with basic softwares, so we will try to understand at basic level, then only we will able to progress in future. Next is nurses can be benefited with integration. So there are few reasons which I have listed down. Is first and foremost, get clear your basic efficient documentation and record keeping. I don't know any of you have gone and seen Nanda International, the website from which we actually retrieve our Nanda diagnosis, and it is followed everywhere. You go and see, they are trying to create and standardize language practice, which will be definitely useful for future AI. There will be AI where you will just mention your patient problem. You will get a list of diagnosis There may be softwares like this where you will get a list of diagnosis which is applicable for your patient. Then systematic medical nomenclature for medicine terminology. Kindly go and see this website, wonderful website, to understand what I'm talking. They have sets of condition. If I put diabetes, put ulcer patient, I will get this list of signs and symptom, list of management. So it is a protocol which is created. Next is very important, personalized care plan. So there is an acronym of ADPI. So ADPI is nothing, again, back to your basics. Get your basics clear, very, very important. Assessment, diagnosis, planning, implementation, and evolution. If these things are clear, then only you will be able to implement. In terms of AI, your patient, you will categorize under assessment. What is the assessment? Subjective, objective data, actual diagnosis, potential diagnosis, risk diagnosis. How will you plan? When you will plan your things also, there will be sections. So morning, when I got the patient, there was fever, which was present with the patient. And what is your outcome will be, you want to have fever reduction at this particular time. So you will set a timer. Okay, this particular time we want reduction in fever. So that is what AI will also try to assist you in telling you the importance. Okay, this timer you will basically set, and whatever medication has been gone to the patient, that analysis also done. Implementation and evaluation, very, very important. If you are planning an integrated pathway, care pathway for your patient, so it will be an easy task. AI will give you the care pathway. You need to follow the steps, and the care will be ultimately optimum level of care will be provided to the patient. Next is the very important is drug interaction alert. So the moment you have given the drug to the patient, you have gone to some other patient and the drug reaction has started. If you have an maybe an gadget or a device with you which is integrated with AI, so you have listed down that this particular drug, this reaction, this particular drug, if we take a any medication, so you are not seeing, you don't want to see a tachycardia, but the patient is getting tachycardia, that will be alerted to you all. So very, very important drug interaction alerts. So remote patient monitoring also. So there can be integration of cloud services. So at home, if the patient want certain things need to be done, so with the help of Bluetooth, of course, extranet is very, very important. So healthcare profession can wearable devices are available. We'll talk about that also. With the help of that, the patient will able to weight measurement, any kind of measurement can be done by. You need a data correction and you need a Wi-Fi cellular connection for this in future, of course. Right now also it is, I think post-COVID, the coming up of or the version of doctor-patient interaction going online has increased. Of course, it saves times also, and it will make sure the infection control protocol somewhere is also maintained here. Then as earlier also I have told, language translation is also one of the important factor which will be there for nurses. Then this is what the website of OpenAI is. So you can go on the link, you can just see a few things on OpenAI. Next, it's just, I have just listed down the timeline. So since 2015, OpenAI was officially started 2016. 18-19, there was various kind of releases, pre-trained transformer. There was OpenAI shift from non-profit status to capped profit status, release of Dell eGenerative AI. Then in 2002, there was like a splurge of AI which came, and 2023 is where your OpenAI plus ChatGPT-4 was released. So OpenAI, basically it is an American company which actually will talk about ChatGPT. So ChatGPT is that is what American startup under OpenAI ChatGPT comes. So in the timeline you must have seen at the end the GPT section. So this is where aim to promote or develop artificial intelligence with human face. This conversational robot marks a new stage of progress of natural language processing algorithms. So I hope everyone is able to see this slide. So I have just put the sentence, make timetable for nursing students. So automatically the AI, with the help of AI, everything is there. So Monday I will do anatomy, physiology, lab sessions. If I get opportunity, I will do. Then few sections, Saturday, Wednesday, all weekly timetable you will get. You just have to put whatever you want in to plan or whatever you want to inculcate. Everything is there, and you can incorporate this all ways in your development itself or in your study timetable. Then chatbot, according like how ChatGPT is available, the derivation of that chatbot as in OpenAI timeline I told, TalkBox, Chatterbox, Interactive Box. So they are when you open any website right now, also any hospital website, you will get a small messenger just that is also in somewhere they are trying to create and vote where the person feels like they are replying to them, but it is a programmed base replied which has already made. It is a bot which they have created for general people. So what, if for example, what is an OPD time for this particular doctor? So you may get a link, cliently go to a link. So all these types of chatbot or ChatGPT, Chatterbox, they have specifically made for this, can replace a human or monotonous job for answering. So e-help desk can be easily, robots are installed somewhere in the institute or in the organization where they'll just search which floor is this OPD and they will get the answer. So a better patient experience with AI-powered chat boxes, share a symptom questionnaire, ask question, provide reliable information, collect patient data, provide medical assistance, and schedule meeting also with the help of chatbot. So moving ahead, we'll see what is augmented reality and what is virtual reality. So augmented reality, virtual reality, there is also one field which is mixed reality. As you can see, everything is from medical section. It is nothing, pictures are not there, which is different, but we'll see now. Augmented reality is, imposes information such as text, images, sounds on the real world, and in other world, AR has enhanced a part of user physical world computed. So basically, I don't know how many of you remember, there was this game, Pokemon Go. So everyone was in their phone going around the Pokemon. That is nothing but augmented reality. So they create a scenario where everything, for example, you can see in this image, doctor is able to see what is the condition of lungs, heart, or able to diagnose. In further slide, I will show you. Virtual reality present to the users with a computer generated environment, making the user feel they are real and visually immersed in that environment. Many research studies are there where augmented and virtual reality both are used, and it is fantastically doing improvements for the patient. Mixed reality is blend of both physical and digital, one unlocking the nature intuitive 3D models. So according to in future also, if you saw the video which was shown, beautiful video, it was shown by Sister Lalita. So in that the person just had a chip, and whatever the investigation was done, so through that automatically the information was sent to that person, to the nurse, to the physician. So that can be included. So if we talk about augmented reality, it is the real world plus the virtual layer, which you will get, then you will get the augmented reality. Virtual world plus real inputs will give you virtual reality. Simple concept of both this. There was this beautiful paper, which I think it is released, yes, between the year 2020 and March 2023, where they had used virtual reality and augmented reality in training for disaster medicine course for nursing students. So they had found a lot of improvement and a lot of collaboration also, when improvement in the sense of they were trying to understand a better way how disaster will come, because when we just ask a person to do a role play, we can't not every time it is possible to create a situation, but that can be done with VR and AR. So few just examples of AR and VR you can see here right now. So the person is able to analyze, doctors, physicians are there, nurses can also do that. So here also you can see the anatomical structure, arteries, everything is visualization done with the help of a virtual reality and augmented reality. They have a headset here to understand things clearer. Then I got a when I was searching or preparing for this session, I got a wonderful concept where they are trying to study cancer more thoroughly with the help of augmented and virtual reality. 1 cubic millimeter of cancer tissue contains around 1 lakh cells to study. So we can identify that with the help of VR. So how to approach that way? First is reference picture. So I will make a software where there will be a reference picture of actual cancer tumors, cutting thin slice of swimmer, analyzing the genetical information. As genetical studies are since so many years here, AI, if we integrate AI, of course, there will be an integration. If we integrate AI in genetic analysis, the information will be more clearer. Then tumor rebuilt in VR, ultimately user can now analyze tumor wearing their devices, that is direct virtual a reality headset also can be used. So next is our robotic nursing, and my personal favorite. Robotic nursing is, robotics basically is an engineering, science and technology of robots and their design, manufacture application. The term robotics was coined by Isaac Asimov in 1947. So see, back then people were thinking so much. That's why right now we have to think about the future. Robotic nursing refers to use of robots in field of healthcare nursing. These robots are designed specifically, functions will be given to support nurses and other healthcare professionals, providing high quality care. So here you can see there is one example of Moxie. It is a robot which is there for helping nurses and patients in Texas. So Moxie is helping us in storing the medication right now. Moxie is helping us, the nurse, to put her data, reminding the nurse that enter her data. All these functions can be done by a robot. Then very wonderful example. I don't know how many actually go and read. This was an recent surgery which was done in India, in Gujarat. Telerobotic heart surgery, first of its kind, was done in India. Done by Dr. Tejas. He was a cardiologist. So they, the best thing about this surgery was they had performed it within the distance of 32 kilometers. 32 kilometers is a long distance. And one more best thing about this surgery was the internet was used was 100 Mbps. Right now for this conference also we are using 100 Mbps of internet. So you can, in 15 minutes the surgery was done. So a wonderful thing which was done with the help of internet and communication. If you see this picture, it's, the doctor, the physician, the surgeon is sat in one place, and different type of system is available from him. The thing which he is handling is an telerobotic surgery intervention. Because of that, he can do multiple things. It is activated by the touch, it is activated by the movement, and in the other screen, if you are able to see, there are doctors with the patient itself. So the last but not the least section for this present session right now is few high-tech gadgets which are available in healthcare system. As earlier session also sister has discussed many, but we'll just focus on few of them. So first is digital peel. Digital peel, I'll just walk you through the mechanism. So tiny silicon sensors will be there present in the peel itself, the smart peel, and a patch will be attached to the person. How normally we have, I hope everyone must have seen a Phentalin patch, how the patch looks like, same like that, the patch will be available. So after the patient has swallowed, if the person has to analyze or understand what any type of tumor, any type of growth. So all these things will be any type of excessive fluid, electrolyte reaction which is happening, that can be understood with the help of the peel. Ultimately, that with the help of the mobile phone, the person, the doctor will get the notification. Then, of course, wearable technology. Smart watches are everywhere. Smart watches have turned the way actually we are using our watch. Everything is available right now. You talk about your fitness, you talk about menstrual health. you talk about any other health related issues which are there in human beings, or anything which the person has to track steps that is available. So smart watches, of course. So one example I would like to give you here is there are various anecdotes which are available in relation with watches. So there's this person of 36 years old which was suffering from cardiac arrest, but the phone has seen a difference of, there was tachycardia, there was checks, and ultimately when he went to the hospital, they had observed that already he had an episode of cardiac arrest, because the smartwatch has analyzed it and the record of data is there. Same, there was also a woman, there were different anecdotes. If you go on search engine, you will get different anecdotes of smartwatches. Then in general, different types of availability of gadgets. There is glucose meter, there is ECG patches. Few watches, like advanced watches, are analyzing your ECG. Ultimately, in future, there will be watches will be actually integrating your sugar level. After food, how much you have spiked. Post food, during night time, how much you have spiked. Night sleep pattern, your waking pattern, how many hours you are standing, everything will be detected. There is TENS, there is body temperature activating tracking devices, wearables, spirometers, various things are there. So few challenges I feel right now, as even at country level or even at world level we are facing, is there is interoperability. Not every person has the ability to operate that or understand the technology, because of course one of the other reason is the technological literacy which is not there. Ethical consideration, if we automatically, if we are sending certain data, the data sensitivity is somewhere loose, data authority is somewhere loose, data security and privacy. Training, you can't, somewhere the training is missing, the investment you required for such training, liability and accountability and professional development. Somewhere the working fatigue which is there, that what we have to overcome with all these challenges which are there, so that only we can develop in the future. So I would like to end with small sentence, but be a tech curiousness, have curiosity, have question, involve technology in your day-to-day sessions or day-to-day life where it is required. Of course, don't get overpowered by it. Don't go to extreme where you will not able to differentiate things, but use wherever it is required. I would like to conclude my topic. Thank you so much. So there is a lot to explore. Be curious, be conscious, and be ready for the future. Thank you so much. Any questions are there? Any questions? Any questions are there? You can just kindly put in the chat box. Okay, so there is one question by Tirza. She is asking, as now AI and ChatGPT is a computerized program in which when we enter a data, but how it will help in making clinical or emergency. That is what we discuss about drug interaction alerts. So you can, of course, in future, there will be, you will have to upload the drug. For example, if we take an tablet dolo, if we take, so what is the action, mechanism of action, what it is acting, and how we can improve the outcome overall, and what are the contraindications. So you can analyze your contraindication, and ultimately you will able to integrate OpenAI and even ChatGPT is integrated. ChatGPT will be used. Software related to nursing will have integration of ChatGPT, where you will, all protocols and analogs will be different. Then there is one more question from Anne. Will technology AI extra have nursing skill development? Nurses being dependent. can hinder. See, skill development is something, or the dependenceness of the technology. That is what I told. Don't get overpowered. And as Sister Lalita also said in the beginning, don't be afraid. It is make an opportunity of whatever situation you are coming across. Don't be dependent that much. Learning skill you have to inculcate. You have to plan things for yourself. Okay, so I hope your questions are clear. Any other questions are there? Of course, anytime you can meet, and anytime all of you all have my number, you can ask me. I'm every time happy to answer your question. So we'll end this session over here.
Thank you, ma'am, for your genuine expression on the topic. As we have come to the end of today's conference, I would like to express our gratitude to Executive Director, Sister Lissy, and the management and principal, Dr. Sister Lalita Rozali, for the soundless push towards the summit of recollecting and assuring the nursing landscape in a unique way. Thank you. Grateful regards to our speakers for the educational and inspiring session, and to your dear associates for your participation. Hopefully, the presentation will be favorable for everyone. Thank you. In association with the National E-Conference, we have also held an e-poster competition. We congratulate all the participants for making this a big success. The most awaited day, the announcement of the prize winners has come.
Just 1 minute.
So the second prize is Miss Sakshi Ghag. And the first prize, Miss Nikita Sinha. Hearty congratulations to all the winners. I request everyone to kindly put on their camera for a selfie moment. Thank you all. Feedback forms are available now. Participants, kindly go to the link and fill in the feedback, which will be sent in the chat box. A certificate will be mailed to the participants' registered IDs following the successful submission of the feedback forms. Thank you once again and see you all soon. God bless us all.
Thank you, sister. Thank you, ma'am.
Thank you.